Tien Lien, Knowledge and Information Manager of Southeast Asia Tobacco Control Alliance, or SIACA, and I will be the moderator for this Symposium 8. Welcome again to Symposium 8 at FCTC Scorecard Measuring Compliance with the WHO Framework Convention on Tobacco Control, organized by Southeast Asia Tobacco Control Alliance, SIACA. Before we going into the presentation by our speaker, I would like to provide a brief background of the FCTC Scorecard. It was developed by the Southeast Asia Tobacco Control Alliance, SIACA, to assess the implementation of various provisions of the WHO FCTC, as well as identify gaps in the tobacco control policy at the national level among 10 ASEAN countries. As a monitoring instrument, the scorecard acknowledges progressive and gaps for selected FCTC general obligation and demand reduction measures. The scorecard also facilitates comparisons between countries so that countries can benchmark against their peers. We are privileged to have Dr. Ulysses Doroteo, who is the main author of the FCTC Scorecard report, to walk us through the main findings of 2021 FCTC Scorecard and also discuss in more depth the Scorecard questionnaire. Allow me to explain the structure of this session. There are two parts. We will start with a presentation from our speaker and followed by Q&A session right after the presentation. Then we will proceed with the second part with more detailed discussion on the questionnaire led by the speaker. We will encourage you to type out your question in the Q&A box below, and all the questions will be attended during the Q&A and discussion session. Without further ado, allow me to introduce our speaker. Dr. Ulysses Doroteo received his medical degree from the University of the Philippine General Hospital, and went on to complete his ophthalmology residency at UP PGH and neuro-ophthalmology at the University of Texas Medical Branch. He also has a diploma in international health from the UP Open University and over 20 years of experience in tobacco control. Currently, Dr. Ulysses is the Executive Director of the Southeast Asia Tobacco Control Alliance, SIACA, a Fellow of the Philippine Academy of Ophthalmology, and also a member of the WHO Civil Society Working Group on Non-Communicable Diseases, NCDs. He is also the World Heart Federation Tobacco Expert Group and the World Conference on Tobacco or Health International Advisory Group and the Philippine Society of Public Health Physicians. With that, I would like to hand over and give the floor to Dr. Yu. Thank you.
Thank you very much, Jian, for your kind introduction. Dr. Natawut, did you want to say anything before we started?
Yeah, I think this section is very important for us. I think we're waiting for you to make clear about this scorecard. And I think Dr. Yen and Dr. Yu will give many information for us. For me, I'm a Thai people, and I very exciting when you enjoy this session. Please share me to your information. Thank you.
All right, thank you very much, Dr. Natawut, and thanks again, Yan. So I'm going to be presenting. I actually have prepared, for everybody's information, I have prepared two slides, two sets of slides. The first one goes over the scorecard in general, what we have developed for this year, and the scores of the different countries in the ASEAN region, with a little explanation as to how it was developed. And then when we go later through the questions that you may have, I have also prepared another set of slides that actually shows the questions, the actual questionnaire that we use to solicit responses from our country partners, and then develop the scorecard. So if you are interested in knowing the actual questions and how many points were allocated per question, then that is in the second set of slides. Okay, so what is the scorecard and why did we develop it? I think what's really important is why we developed it in the first place. We all know that tobacco kills 8 million people every year out of 1.3 billion tobacco users in the world. And if we compare that to COVID-19, which currently has had about, since yesterday, the other day, 218 million cases globally and 4.54 million deaths globally, that's actually just half of what tobacco kills in a year. So there really is a greater urgency required in implementing tobacco control. And how do we do that? Well, we have the FCTC, the Framework Convention on Tobacco Control, which has been adopted and ratified by 182 parties, including the European Union. So we already have the bare minimum blueprint for tobacco control. We know what works and what doesn't work, and that is contained in the FCTC. So really what we're trying to answer is the question of, are we there yet? Are we closer to the tobacco end game and ending all of the 8 million deaths per year? What are we doing in terms of tobacco control and FCTC implementation to get us to that point? So if we look at the ASEAN region and the numbers of smokers and the prevalence of tobacco use in each country, we still see that we have 124 million adult smokers in the ASEAN region alone. So that's about 10% of the global population of tobacco users. And the numbers are quite high in many countries, particularly Indonesia, which has a prevalence rate of 33.8, so 34% of adults are smoking. That's 65 million people. But we also have good news. Singapore, as of 2019, they were registering a prevalence rate of 10.6%. And then last year in the news, we learned that it had dropped to 10.1%. So they're quite close to lowering it to what most people consider the tobacco endgame, a prevalence of 5% or less. So there is progress being made, but we want to see that that is continuing over time and can be accelerated. So teen smoking, and that includes e-cigarette use, is quite alarming. You know, the Philippines is the highest for e-cigarette use, 11.7% among middle schoolers, high school, and other countries are not far behind. So Indonesia 10%, Malaysia 9.8%. For cigarette smoking, Malaysia tops it at 13.8, Philippines at 12. So if we want to really reach the tobacco endgame, we have to reduce these numbers as close to zero as possible. Otherwise, we're just continuing the next generation of tobacco users. And of course, as we mentioned, e-cigarettes are a challenge for everyone because these new products are rapidly being taken up by both adults and young people in our region. So the question is, are we doing our best to get the FCTC implemented and therefore bring these numbers down? The latest Global Tobacco Epidemic Report from WHO, published just a few months ago, shows us that we are very far from the tobacco endgame at the global level. There has been significant progress in terms of what you see on the screen is pack warnings, for example. In 2007, only 5% of countries had effective health warnings, but now that has increased to 55%. But even then, 55%, it means 45% of the world does not have effective health warnings. And if we look to the far right of the screen, we look at taxation, only 13% of the world has effective tobacco taxation, which we know is among the most effective ways of reducing tobacco use. So we have a long way to go. Progress has been slow, right? This is not to say that governments and society are not trying, but this also, if you listen to our plenary session yesterday, we wanted to emphasize that one of the main reasons that tobacco control has not progressed as fast as we would like is because of tobacco industry interference. If it were not for tobacco companies and their front groups and legislators and policymakers who are sympathetic to them, the FCTC would have been implemented at a much higher level by this time. So what the FCTC scorecard will do is to measure that progress, the success and the gaps, as Yen had mentioned earlier. So these are the covers of our previous two scorecards published in 2016 and then 2018. And we usually time the publication of these scorecards ahead of the Conference of Parties. So this year, the conference will be meeting in November. And so we will be publishing, launching our 2021 scorecard ahead of the Conference of Parties. So the Conference of Parties is in November. We're aiming for an October launch of this scorecard for 2021. So let's go to the scorecard itself. Now, what is the scorecard? What is it, first of all? It's a civil society assessment. We do not expect governments to be very honest necessarily with their assessment of their own performance. So this is a sort of like a shadow report of what countries' governments will submit to the Conference of Parties. So the conference requires parties to the FCTC to submit reports to the conference every 2 years on how they are implementing their obligations under the treaty. And so, of course, governments don't like to look bad, so they will report how well they're doing, but they will rarely report how badly they're doing or the challenges that they're facing. Or even if they've made mistakes, they don't report that. And so it's hard to learn from what countries are experiencing. So we are hoping that this scorecard as a civil society report will give us a better picture or will complement what the government report is showing. The report also is based on the FCTC guidelines that were adopted by the Conference of Parties. And so that means that this is a more objective way of assessing if governments are implementing, because the guidelines contain the best practice for FCTC implementation. So there are guidelines on Article 5.3, Article 6, 8, 11, 13, 12, 14, and 9 and 10. So we cover most of that. And then the scorecard itself allows us to give numerical score or a grade to gauge the performance of FCTC implementation. So we can gauge from time to time, over many years, whether that score is improving or not. And we can also compare one country with how it's being implemented in another country. So a regional comparison for ASEAN is also useful, because obviously governments don't want to be at the very bottom if they can avoid it. And they, of course, want to be at the top so that people will see that they are implementing their treaty obligations as they are supposed to. So what's new in our 2021 scorecard? This version has new or enhanced questions. So what does that mean? In the previous scorecards, we were not as detailed in some of the questions, because it was an initial, when we first started, we didn't want to make it too complicated for our country partners to answer the questions. But with the last two versions, we thought that it wasn't, the lack of detail did not do justice to the actual scores. So we wanted to see if, for example, we give a score of 5 out of 10. People will ask, well, why 5? What is missing? What are they not doing well? And I think the additional questions give us more information. This is particularly true for Article 5.3, tobacco industry interference, because in the past we were focused on governments having a code of conduct for their officials, but not enough attention was given to tobacco industry interference in other aspects. And then there are also new developments. So for example, the FCTC protocol on illicit trade entered into force, and so we added a new question on Article 15. We also added questions that would cover standardized or plain packaging, because both Thailand and Singapore now have plain packaging. And also because of the aggressive sales and marketing of electronic smoking devices, we revised the questions to cover these new products as well. And then, of course, as a review to make it relevant, we also adjusted some of the weights for each of the FCTC articles. And what we also added, the last bullet point here, is a deduction of 1 point from the overall score for non-parties. This is something we copied from the European Union tobacco control scale, where they also deduct 1 point for non-parties in the European Union. Of course, in our region, this only applies to Indonesia. So these are the weight of different articles. As you see, Article 6 has the largest weight, and this is because we know that this is the most cost-effective way of reducing tobacco use. So if countries were to implement Article 6 taxation very, very well, we believe that this will have the biggest impact on tobacco use. Article 5.3 is also scored quite high because it is the strongest obstacle to tobacco control success. So if we can reduce tobacco industry interference, then we can also succeed much better with FCTC implementation. Okay, so we looked at all of these articles and we weighted them based on their impact for tobacco control and how much they would contribute to bringing down tobacco use, as well as the relevance in region. For example, illicit trade is only given 3% of the score because we know it's important, but even if countries ratified the protocol to illicit trade, and that's the only question for Article 15 at the moment, we know that it will not have a very huge impact on tobacco use at the current time. So we'll entertain questions on this later. So let's go through each of the articles and how countries scored with regard to each of the articles. So Article 5.1 and 5.2 really deal with how countries provide the basic framework for tobacco control in their countries. 5.2 is about tobacco control focal points or national coordinating mechanisms, and 5.1 is about tobacco control strategies and plans. So if we go through the scores, what you see on the screen are graphs of the different scores that are already weighted. Almost all countries have tobacco control strategies and plans. That's the green bars that you see. Green means they have a full score, 100% for this particular article. And then yellow means they have achieved at least 50% of the score, and red means they have scored below 50%. So for tobacco control strategies and plans, you see that Indonesia and Myanmar do not have tobacco control strategies and plans at the moment, which is very sad because how can you implement something if you don't have a plan, right? And then Brunei and Cambodia do have strategies and plans, but the scoring reflects the fact that if we look at the questions themselves, this is the next slide here, you see for Brunei and Cambodia, they don't score very well on the last question, sub-question. That means they don't periodically review and update these strategies and plans. So that's the reason that they have not a full score on this graph. And then for 5.2, National Coordinating Mechanism or focal point, which is 5% of the overall score, half of the countries have well-established and funded mechanisms or focal points. So that's Myanmar, Singapore, Thailand, and Vietnam. Others score quite low, not as low as Indonesia, which does not have a national coordinating mechanism for tobacco control. So coupled with that, the fact they don't have a tobacco control strategy or plan, that puts them in a very, very bad position because they cannot implement tobacco control well, because these are very basic to begin with. The countries that have yellow here, Brunei, Cambodia, Myanmar, and Philippines, they score lower because, as you see from the questions, they don't have enough adequate, they have inadequate human and technical resources, or they don't finance these focal points very well. So that means you have one person maybe working part-time on tobacco control, and they don't have funding for tobacco control programs. So that's why the score is lower for these countries. So I hope I gave you a good idea of how we implement, how we are scoring countries with regard to the FCTC articles, the various articles. So we'll go through the other articles, but we won't show you the questionnaires as a backdrop anymore. But I just want to show you how we scored the other articles. Okay, so the basic stuff seems to be doing quite well generally for most countries. But if we go to the next article, which is 5.3, you can see that most countries are doing quite poorly. But there is progress, you know, so Brunei, Myanmar, Singapore, and Thailand are doing efforts, so they score above 50%, but no country has scored fully. And you'll see later that we have a very long set of questions for Article 5.3, as it should be, because this is one of the bigger score components. For taxes and prices, also significant number of points. This is 18% of the score. Only the Philippines scores more than 50%, and all the rest score below that. One good thing that we can show here is that all countries are actually implementing tobacco taxation policies, but not at the level that they should be based on our scorecard. So I hope we can discuss more of this when we look at the actual questionnaire later. And of course, if you have questions, we'd be happy to answer. And I just want to point out at this point that one of the major things we always look at when we talk about taxes and prices is affordability. So if cigarettes, this is the main thing we measure at the moment, if cigarettes are cheap in your country or affordable in your country, then you will score relatively low. If they're expensive, then you will score higher. For Article 8, smoke-free environments, there's much more progress here. As you can see, 6 countries score higher than 50%. But there is no country that has scored 100%. So we actually can see that there is still room for improving the way that we implement Article 8 of the FCTC. So later you will see that one of the reasons that countries score quite low or lower than we would expect for Article 8 is because we consider implementation and enforcement as well, not just the policy. So even if, let's say, for example, your country has 100% smoke-free indoor public places in the law, but it's not well enforced, you do not get the full points. So this will reflect in your score. So this is a way for us to tell governments that you need to do more in terms of enforcement. For Article 11, quite encouraging, you'll see here examples of plain packaging from Singapore and Thailand in the bottom row. And then there are countries also that have 80% health warning size. That's Laos and Myanmar, which are second largest. So Thailand has 85%, which is the largest in the region. Other countries, of course, need to catch up with larger warnings and standardized packaging. So that reflects in the score. You see here, Thailand has a perfect score of 9%. This is because they have plain packaging, they have or standardized packaging, they have health warnings larger than 80%, and other components of packaging and labeling as according to the guidelines of the FCTC. But across the region, we're not seeing any zero score. So even Indonesia has a score of around 3% out of 9, so 1/3, because they have graphic warnings, which is a big step. Other countries are doing fairly well, more than 50% score for the set of questions for Article 11. And then the other countries that are lagging below 50% is because either the health warning size is low, smaller than what we advise to be or recommend in the guidelines, or they haven't rotated their health warnings, for example. So implementation enforcement is an issue. For Article 12 on education and public awareness, all countries are doing this. Let me go back to that. So on the left, you see the 2-year-old Indonesian boy who was smoking and went viral on the internet some years ago. I think this is maybe 10 years ago already. But just to show you that we need to raise awareness, and countries are doing quite well. So Singapore, Thailand, Vietnam, even Malaysia and Brunei are doing well in terms of raising public awareness, but no country is at 100%. So there needs to be further strengthening of how we train people to be educators and also put out messages with regards to tobacco control, tobacco use, and even messages about the tobacco industry. So those who are scoring below 50% clearly need to catch up. With regard to Article 13, which is on the TAPS ban, here, on this slide, I just want to point out that if it's out of sight, out of mind, that is the plain white rectangle that you're seeing, then people don't think about smoking, right? But in the lower row, you will see advertisements, and even at the point of sale, you see a wall of what we call a power wall of tobacco products on retail display underneath the advertisements. And many research have shown that this is done on purpose so that when people go to the cashier, they see the display and they make an impulse buy. It's also at the eye level of young children who go to the counter looking at candy, for example, but they see tobacco products in their nice colors and attractive packaging. So it makes them curious about tobacco products. And then the bottom right corner is a photograph of CSR done by the tobacco companies during this time of COVID. So it reminds people that tobacco companies are doing well, that they're good guys. It polishes their public image and also buys favor with policymakers. So these are forms of advertising, promotion, and sponsorship. So how are countries doing? Well, we gave this a score weight of 10%, and you can see that no country scores perfectly, but there are also countries that are doing very poorly. So Indonesia, Myanmar, Philippines, Vietnam are doing quite poorly. Some of this is because of advertising still being allowed, like in Indonesia and the Philippines. And other times it's because of CSR by tobacco companies like in Malaysia and Vietnam, and in other countries, of course. So more needs to be done. For tobacco cessation, which is Article 14, all countries are also implementing measures to help smokers quit smoking. Leading are Singapore, Malaysia, and then Vietnam and Thailand. So they have established programs for helping people to quit smoking. So yesterday I heard Thailand has very many, a whole network of smoking cessation clinics. So why are we not so successful? Well, if we look at the questions, maybe it's because people don't have access, so maybe the service is available, but getting to the cessation clinic might be a problem, especially now during the pandemic. Or they're not aware that the service exists. Or there are not people who are trained to provide cessation services. All of these are under Article 14 of the FCTC. And then for Article 15 on illicit trade, we just have one question, which is, has your country ratified, or are you a party to the protocol? And no country is currently a party, so we all scored 0 for this question. So it's just one question, but this is to remind parties, governments, that they have an obligation to eliminate illicit trade. And one way to do that is to signify their intention to ratify. Myanmar has signed onto the protocol but has not ratified. So we need to do more on illicit trade, because this is one of the major arguments of the tobacco industry against tobacco control measures like taxation and standardized packaging, or even smoke-free and health warnings. And then on financial resources, which is Article 26 of the FCTC, we know that governments cannot implement well if they do not have the budget to carry out their programs. So are governments allocating that funding? And unfortunately, if we look here, quite sad to note that only Singapore, Thailand, and Vietnam seem to have resources going to tobacco control. Singapore scores a 9, but the caveat here is that Singapore's budget, from what we can ascertain for tobacco control, we don't know the actual amount that goes to tobacco control. This is for all of their health promotion programs. So in any case, it's a huge amount per capita. What we measure is per capita spending for tobacco control. It's still a huge amount, so they still probably would score 9 out of 9. Thailand, even though there is a Thai Health Promotion Foundation, overall, if we look at per capita spending, there's actually insufficient spending for tobacco control. But still, you know, it's 4.2, so close to 50% of what they should be spending. And for Vietnam, they have a Vietnam Tobacco Control Fund, which is very well resourced. So at least in that regard, they are sufficiently funded. But for all other countries, we don't spend, you know, we spend very, very little in terms of tobacco control. For Indonesia here, we don't have any data at all on how much they're spending. So the 0 may not be a 0, but we score 0 at the moment because there is no data. So if we combine all of those scores together, this is what we see. The top graph shows you the overall score. So Singapore and Thailand are doing quite well overall, more than 50%. The others scoring yellow are 50% or close to that. So Brunei, Laos, Malaysia, Philippines, and Vietnam. And then those scoring below 40% are Cambodia, Indonesia, and Myanmar. So a lot of improvement needs to be done. However, if we look at the lower graph, what you see here is a comparison between 2016, 2018, and the current score. Now, we cannot make a direct comparison with the previous scores because we have changed the questionnaire. So we added questions. We also revised the weights for each article. So there's no direct comparison. But even then, I think we can see that there's not been a huge amount of progress in each country over the past 5 years. Okay, so we need to do more to improve both the policy and the enforcement in our countries. So let me end with a couple of slides that show you that, yes, basically we're closer, but we're not close enough, and we need to go faster. The obstacles that are identified by parties in the report to the Conference of Parties says lack of human financial resources are the most frequently cited problems, and then tobacco industry interference is the most important barrier to the implementation. So we cover this in our scorecard. Some suggestions, of course, is in doing more, and maybe we will start to see some of this in the next scorecard, is how to restrict access more, look at the supply side a bit more, because we're very focused on the demand reduction side. But the supply side means raising the minimum age to 25 so that it's no longer accessible, licensing all tobacco retailers as done in a few countries like Thailand, and this will help with tax implementation and illicit trade control. Reducing the number of retailers and including phasing out tobacco products over time, banning single stick sales, banning kiddie packs, banning flavors, banning tobacco scenes in entertainment media. all related to taps and tax mostly. But these can be ways to strengthen our tobacco control to prevent uptake by the young people. And then there are areas also where we haven't focused at all. And so we've looked at standardized packaging, but not only 2 countries in the region have this. No country has banned flavors or regulated nicotine sufficiently. No country has done very well with alternative livelihoods other than Malaysia. So we have lessons to learn from Malaysia, but this is not covered in our scorecard. And then reducing production, capping production of tobacco products, phasing out tobacco products. These are things that we should be thinking about if we want to reach the tobacco endgame. And of course, litigating the tobacco industry, bringing them to court, making them pay, and making them accountable for the damage they cause. So just some suggestions, both for further work, and we can probably include this in our next scorecard if these are things that are starting to happen in our region. So thank you very much. If there are questions, we can take them now. And also, please feel free to email me. My email is on the screen, ulysses@siatka.org. So I'll close here. Thank you, and back to you, Yen.
Thank you very much, Yul, for very insightful and comprehensive presentations on the 2021 FCTC scorecards and its findings. We still see a lot of red bars showing the gaps in the policy implementation in some FCTC articles in most ASEAN countries. It means a lot of improvement that still needs to be done to further strengthen the current tobacco control law and regulations. We will now open for Q&A. If you have any questions, please kindly type up your question to Dr. Yu in the Q&A box. Yeah. I will start.
There is a question. There is a question about what year is this scorecard for. So this is the 2021 year scorecard. It covers up to the end of 2020.
Okay, yeah. Okay, I have a question for you, Yul. In most countries, even with a strong tobacco control law or regulation has been in place, it does not guarantee that it will have the desired impact. So as you mentioned earlier, enforcement remain the big challenge, and how will this translate or reflect in your in the questionnaire and the scoring? Can you explain further on this?
Okay, maybe I should show you a sample of the questionnaire.
Okay.
Okay, so let's take, for example, Article 8, which is smoke-free. So I mentioned in my presentation that countries might have a very good policy. So maybe their law says 100% smoke-free public places. Indoors. Okay. What you see on the screen is our notes on how we that we send to our country partners when they fill up the questionnaire. And so here you see in the explanatory note, we define electronic smoking devices. So sorry, it's actually defined under Article 5.3. We can show that to you as well. But there's a definition for indoor enclosed areas. This is based on the FCTC guidelines, as well as definitions for public places, public transport, and smoke-free. But we try to simplify some of the language in case there's any ambiguity. So for example, for public transport, transport terminals should be considered under public places. So this is because some people will ask, well, if the bus terminal or the train station, is that under public transport? Is that under public place? So that we don't have overlapping scores or ambiguity, we consider them under public places, but the train itself or the bus would be considered public transport. Also because in the airport, for example, there are restaurants, there are common waiting areas, lounges. These would be considered public places rather than public transport. And then enforced here, you see a term which is enforced. So it means very well enforced. So this is a bit subjective because there is no way to fully and fully objectively quantify how well the enforcement is being done. So we say that at least 90% of these places or settings are smoke-free. So if it may be impossible because there will be smokers who want to violate the law. Well, that doesn't mean that it's not well enforced, right? So that's our definition. And then partially enforced means fairly well enforced, so also subjective, or around 50 to 90% of places are smoke-free. And then meaningful restrictions applies to subnational smoke-free regulation. So there's no national law, but under the subnational jurisdictions, there are restrictions. Then we score these as, we consider these meaningful restrictions. So if you look at the questions themselves, okay, here, you'll see for indoor workplaces, including bars and restaurants. So we say choose only one. All indoor workplaces are 100% smoke-free. There's no smoking room by national law, and it is enforced. Okay, so that means it's well enforced. You get 5 points. If it's only partially enforced, that means fairly well. Then you get 3 points because we don't want to give you a 0 if it's not well enforced. I mean, there is some enforcement. It's just not very good. So we give you a partial score of 3 points. And then if there are some indoor workplaces that are 100% smoke-free by national law, that means not all. So let's say only schools and medical facilities are smoke-free. But you go to restaurants and other public places, they allow smoking or smoking rooms. You score lower, even if it's well enforced, you get 2 points because we know that you really should have all public places 100% smoke-free. And then the letter D is meaningful smoking restrictions. So that means subnational laws, for example, are enforced, then you get 1 point because what we want is to have a national level of implementation. So I hope that answers the question.
Yeah, it's very clear that enforcement is very important component. It's part of this scorecard questionnaire. Yeah, and I have another question. Who do you think that should be involved in the study? In your opinion, because you mentioned earlier, this is a civil society assessment scorecard. Do you think that there should be the civil society or government agency to take lead, or who should answer or provide the score and complete this questionnaire?
So yeah, I mentioned that this is a civil society report. And I think I did bash the governments a little bit earlier because I said no government wants to have a bad score. So usually they will praise themselves. And they do this in their conference of parties every 2 years. No? So parties are required, excuse me, they're required to submit reports on implementation to the conference every 2 years. And if you look at their implementation reports, they will obviously say, oh yes, this is what we've done. But you will rarely see any country that says, this is what we have not yet done. And so you don't identify the gaps that need to be fixed. And this is what we try to show in our scorecard. So we do actually consult government officials if necessary. So if we need more information to back up the scores that are given, or there are countries where we don't have any civil society partner, we can actually contact the Ministry of Health or our government partner in that country to help us fill up the scorecard. We don't attribute the scorecard to them because they will probably say that they cannot officially get it approved. But out of necessity, we do consult government officials. But this is really intended to be a civil society report and, in a way, a shadow report to what the government report will show. So it hopefully will complement what the government report that is submitted to the COP.
Yeah. Okay. Thanks, you. Last question, you. If there are countries that are interested to do the same SCTC scorecard, can they easily adapt the questionnaire or monitoring instrument to carry out the similar research in their country? And what kind of support that can be provided to them?
Okay. Yeah, when we developed the first scorecard, we were actually thinking that, let me backtrack. When we developed the first scorecard, we were actually thinking about the European tobacco control scale that I had mentioned earlier. So the EU has its own version, which is called the EU tobacco control scale. The questions are different and the points are different. Okay, and I think this tells us two things. The first is that it has to be relevant to your particular country or region. So if we were to take the EU score scale and use it in the ASEAN region, I don't think we would score the same, because they look at, for example, tobacco cessation or even pricing in a different way. And that's because they have a harmonized way. You know? So the Tobacco Products Directive is one of the main policies that they follow. We don't have a similar set of regulations for the region. Also, I don't think they follow, they interpret the guidelines in the way that they set up their questions. So it's rather simple. In our scorecard, we tried to adapt the guidelines as much as possible. So the first EU scale came out, I believe, before the guidelines, any guidelines were developed. And so our scorecard tries to improve on that by using the language of the CDC guidelines. And so we can be more objective in the way we grade or we score country government performance. And then with regard to adapting, so the way we have weighted the scores is also different from the EU. If we look at I showed you earlier the different weights that we apply to the different articles, and even the set of articles that we selected are different from what is in the EU scale. Let me bring that up for you. Okay, here we go. And the reason for that is because these are what we believe are applicable to our region, what is relevant to our region. So Article 6, tax and price, is relevant for all regions, 5.3 also for everyone. But for example, Article 5.1, 5.2, while these are basic, our scoring for this is just 6 and 5%, because we know that even if you don't have a strategy or a mechanism in place, you can still implement some of the other policies. Like I mentioned, illicit trade, we only have one question. I think the EU scale has more than one question. But really, the way we weight this is on the impact to the region in terms of reducing tobacco use and its relevance to our countries. So I think if this were to be adapted to another region, then obviously we'll weight the scores differently. Okay? So we will not have a scorecard that we can compare all countries across the world. Maybe that's possible at some point in time in the future, but at this point, I think it's a very difficult thing to do because the context is different in every place. Of course, if there is anybody interested to adapt the scorecard to their region or even to their country, we would be happy to assist you. The questionnaire is readily available. So I showed you earlier one set of questions. The whole scorecard is readily available, and even how to compile the scores and calculate the scores, that's all readily adaptable for your region or for your country. Just email us. No?
Yeah. Thank you for explanations, a very detailed explanation. It's very clear, so the country who is interested can contact Dr. Yu directly. Yeah, we are free. We are there to support you. Yeah. Okay, Yu, I think we will close for Q&A sessions now. We will resume and continue with the second part of this session. I will give the floor back to Dr. Ulysses to discuss in detail the questionnaire that SIACA has developed. Okay. Over to you, Yu.
Right.
Thank you.
Thanks, Yan. So we'll do this quickly. We only have, well, we still have, we have about half an hour.
Yeah.
Dr. Kramer also asked, she said she's very curious about why Indonesia is doing so poorly. I think we will see that in the questionnaires, but let me run through the questionnaire for everyone, and then we will look at Indonesia, okay? And I actually have, I haven't prepared on slides how each country is doing, but I do have graphs of all of that, and I can show that to you from our draft report. So let me go to that at the very end of the questionnaire. Sorry, I have the wrong slides up. Okay, so what I will show you now is the actual set of questions that we sent to our country partners, and a bit of the calculation for where calculations are required. So for 5.1 and 5.2, I showed this to you earlier. We provide the question, and then we provide the maximum number of points for the sub-questions. So for each article, there's no set number of questions. So for Article 5.1, there are 3 questions. For 5.2, there's 1 question, but 3 components. And so for a maximum score of 10, here we put check boxes because some countries may have only done A and B, but not C. Like for example, I think with Myanmar, they have a focal point. And maybe not even for B. So if it's not adequately financed, then you would check only A. And if there's only 1 half person or 1 part-time person, that would also be no points for this. And then if it's financed, then we also check. If it's not well financed, then we don't check. The number of points that were allocated here were based on discussions we had internally as well as with country partners. So hopefully this reflects the relevance of the question. So also for 5.2, we don't score them equally because we know that even if you have a coordinating and focal point, it's not enough. You need to have technical resources, you need to have financing. And so score actually more because you may have 1 part-time person as your focal point, but if they're not doing anything or they're doing very little or don't have financing, then it doesn't really help that much. Same thing for the others. So here we have plans and programs, but if they're not reviewed and updated or they're not evaluated well, then they're not as useful. So that's why we score them differently. For 5.3, this is the biggest change to our scorecard from the last time. But here I want to show you we actually define the tobacco industry and we define electronic smoking devices. So the industry now also includes those that manufacture or promote or sell electronic smoking devices. That's the new part of the definition. And this covers, of course, even in the old definition, it covers front groups, lawyers, lobbyists, etc., that promote the interests of the industry. Okay, so this is these are the questions. There's a very long set. So the guidelines talk about raising awareness. There are provisions in the guidelines, recommendations on limiting interactions with the tobacco industry and ensuring transparency of those interactions that occur. And so we have broken them down. The language that is used here is actually taken from the guidelines themselves. So this will hopefully provide less ambiguity when we answer the questions. But the points themselves are distributed based on the entire set of questions for Article 5.3. And so raising awareness, we gave points overall. Limiting interactions, we gave 15 points overall. So this means that limiting interactions is, in a way, more important than raising awareness. Rejecting partnerships was given 20 points. Okay? Because we're seeing a lot of partnerships happening. And so without these partnerships, there would be less interference. And then we gave 40 points. Okay, this is the largest chunk of points for Article 5.3. 40 points for avoiding conflicts of interest. And this is because this is the biggest way that the tobacco industry interferes with tobacco control policy. Whether that's in a hidden way, so there's no disclosure. So it relates also to transparency and accountability, but also with regard to the revolving door that happens between governments and the industry, with regard to having government officials that are maybe in favor of the industry and are part of government delegations to the Conference of Parties, for example, and even state-owned tobacco companies. There is huge conflict of interest. And so we give 40 points to this particular set of questions. And then there's also requiring transparency and accurate information from the industry. Very few countries actually require information from the industry that can help reduce tobacco industry interference. Denormalizing CSR and not giving preferential treatment to the tobacco industry. So these are also allocated 15 and 10 points. So what I wanted to show here is there is really a whole range of questions that are asked with regard to implementing 5.3, and we allocate points differently for each section depending on how we feel how important these particular areas of 5.3 impact tobacco control. Okay. If there are questions, I'm happy to go over individual questions later on, if there are such questions. For Article 6, also very important, we allocate 18% of the score to tax and price. And here you see from the explanatory notes, affordability is something very important that we try to measure. Now, it's hard to measure affordability from compare them from country to country. Within the country, that is easily done by what is called relative income price. This is a measure of affordability that we apply to tobacco products within that country. So if it's affordable in one country, it may be more expensive in another country. So for example, in Singapore, a pack of cigarettes might be considered affordable, but in the Philippines or in Cambodia, that might be considered expensive. So we want to compare across countries. And the way we do this is we look at GDP per capita, and then we take into account purchasing power standards to determine the score on affordability. And I'll show you that in the next slide. And then there are also notes on long-term tobacco tax plans and comparable taxation, just to explain how the question should be answered. So for affordability here, which is the first question, countries are classified based on their level of income. This is the World Bank classification. And then we look at GDP per capita. We looked at the IMF data, so we can track over time. Unfortunately, this year I discovered that the IMF data actually changes from year to year. The figures for 2016 and 2018 are exactly the same as they were in previous reports of the IMF, but they're close, so they're not that different, but they're not exactly the same. So anyway, I put them here just so that we can see that there are trends of increasing GDP per capita for some countries, and then some have declined. So for example, for Singapore, it actually went down over the past 2 years, but for Brunei, went up. The biggest jump was for, I think, Vietnam grew so much, from about 10% higher, okay? While for some countries remained about the same. So let's say Philippines, about the same as last year, slightly lower, but about the same. The purpose of looking at this is that GDP per capita is a way of measuring how people spend their money, how much income they have that they can use for spending. And what we did, copying from the European Tobacco Control Scale, is we averaged the GDP per capita for all countries. So that's 25,000 as the regional average. And then we use that as our proxy for 100%. Okay? So if countries are, so 100% means that the PPS, or purchasing parity standard, purchasing power standard is synchronized across the region. So close to 25,000 is Malaysia, right? So 27,000. So they're slightly above 100%. So they would be 108%. So whatever we apply, this is the factor we apply for Malaysia. For Brunei, we would apply a factor of 2.45, so 245%. For countries that are poorer, so let's say Cambodia scores 18% of the average, so we would apply an affordability factor of 18% only. So in this way, countries that are richer have to have higher taxes and prices, while countries that are poorer are not required very high taxes and prices. What would be applicable to them? Okay, so sorry, I did not put the actual scores for countries, but we can look at that later. But here you see the allocation of points per question, and affordability gets 15%. Excise tax structure, whether they are specific or ad valorem, mixed or tiered, also gets 15%. And you'll see here that the 15 points for tax structure is actually just choosing one. Okay, so 15% if you have a specific or uniform mixed tax structure. Countries that have specific or tiered specific or tiered mixed taxes have only half of that number of points, because we know that tiered taxes are really not effective. They function like ad valorem. And then if you have a purely ad valorem system, then you get 3 points. 3 points is because you do have some effort at taxing, right? If there are no taxes, that would be 0, but you tax, and so it's only 3 points. So that's the way we allocate points. Okay? And then we look at whether there are regular tax increases, whether all products are taxed in a comparable way, whether licensing is required, whether payments are made on time, whether there's anti-forestalling, whether there are tax stamps or fiscal markings, whether there's any tax revenue that is allocated for tobacco control, whether duty-free products are prohibited or only taxed. So these are all according to the Article 6 guidelines also, with corresponding number of points. And I will rush now. I don't know how much time we have left, Ian, but you'll tell me, right? So Article 8, we looked at this earlier in the explanatory note. And so enforcement is the big part of how we score. If there is no enforcement, you get a score of 0. Okay, I hope that's clear. Because it's rather useless to have a policy but no enforcement. We initially had thought about, well, what if you have a policy but it's not enforced? Should you get at least 1 point for the policy? We were thinking of that, but because this is smoke-free, and because really no enforcement means really no effect, we thought, no, this is so basic. If you have a policy and you're not able to enforce it at all, you should really get 0 points. Because this is very basic with tobacco control and smoke-free. And so you see the allocation here. We score 5 points each for indoor workplaces, indoor public places, and public transport. And then we have questions on outdoor public places. So this is only 3 points because not all outdoor public places need to be smoke-free to be ideal, but places where people convene, like public parks, open markets, these should be smoke-free. So we give additional points. And then civil society as an active partner in policy making and implementation and enforcement is included here because this is in the guidelines as well. So we add 2 points for that. Okay. For Article 11 on packaging and labeling, this is really very technical. Either you have it or you don't have it. And this includes plain packaging, health warnings, and then size, misleading information, like low tar, light, and mild, which should be banned, and also covers electronic smoking devices now. So for plain standardized packaging, we allocate 10 points because we know this is very effective for denormalizing tobacco use. The size of the health warning is also very important because the industry likes to have minimum size, which is 30%. So less than 50%, you get 1 point. Okay. And if you have more than 50 but less than 80, you get 5 points. And 80% or larger, which means really large, you get 10 points. And so I hope you understand why we give them this kind of point allocation. And then for pictorial health warnings, if they're required, then of course you get additional points. For other packages, so for cigarettes, you get 1 point. Cigars, you get another point. Roll your own, another point. So these are additive, which means that if you require pictorial health warnings on all products, then you get 6 points. Okay? But if you only require for cigarettes but not for others, then you only get 1 point because health warnings should be on all product packages. Location is important because the industry wants to keep it on the lower part of the package, like in the Philippines. So Philippines would score 0 on this question. And then rotation is important because we know that you need to refresh the warnings from time to time, ideally every 1 to 2 years. And if it's not happening, then you don't score on this question. Misleading descriptors are also here. That includes tar, nicotine, and carbon monoxide yields and expiry dates, as mentioned in the guidelines. And if you have a quit line on your packaging, then you get an additional 1 point. Okay. For Article 12, I think there are 2 things here. One is public awareness, and then the second is training for tobacco control advocates as well as the public. And so we have training programs and public awareness programs. We also have multi-sectoral collaboration and a tobacco control database. So this is helpful because we know government officials, they rotate in and out all the time. So having a database is important for their capacity building, but also for the public, media people. Where do journalists get their information? Do they get it from the industry, or do they get it from the government's database? So this is really important. And part of this also is information on the tobacco industry and having it freely publicly available. So this is a work in progress because we know that many countries do not have this in place. So this is just to start us. The Article 12 guidelines are actually quite more extensive than this. Article 13 is on TAPS ban. And so we look at advertising. And it's important here that also like smoke-free, this is very basic. If you have a ban in terms of a policy, but it's not well enforced, then it's not effective. So we explain that here partial or unenforced TAPS bans are ineffective because the industry will then put its money elsewhere to promote or to market its products, like in CSR. So we break down the ban in terms of conventional tobacco products and electronic smoking devices. I need to mention here that if you have a ban on e-cigarettes and HTPs, then you get full points. So immediately. And that includes also other areas of the scorecard. For other products, and even for ESDs where they are not banned, we break down the ban in terms of mass media, in terms of outdoor advertising, internet, at the point of sale, and then also indirect advertising, promotion, sponsorship, and cross-border advertising. So these are all according to what is in the guidelines, but we allocated points so that countries can score. We don't want to have countries score 0 as much as possible. So there are countries that might ban advertising in TV and radio and print, but they don't ban advertising at point of sale. So they would score partially on this question. There's also entertainment media depictions, which is a new question for us. But this is important because the Conference of Parties has a working group that is trying to develop additional guidelines on this particular issue. And there are lessons to be learned. So Thailand, for example, does some censoring of tobacco scenes in their entertainment media. And then for tobacco cessation, we've expanded this a little bit so that it covers both treatment guidelines and cessation support in terms of networking and a quit line. Before, we only had, I think, the quit line, but now we realize that there's more to be done, so there's greater nuance in answering this particular set of questions. The guidelines are important, so they're given the biggest number of points. And then for the quit line, it's given 3 points. And this is actually part of the training and support network that is required, so they go hand in hand. And then there's also mandatory record of tobacco use status and cessation in training curricula for health professionals. And we added these questions because, as a health professional myself, these are often not emphasized in our training. And then for illicit trade, I mentioned there's only one question: are you a party to the illicit trade protocol? We all scored quite poorly. And then for financial resources, only one question: what is the government spending for tobacco control per capita? And I showed you how that was scored by the countries. So let's look at Indonesia to answer Dr. Kramer's question. Let me show you the breakdown for all countries. Okay, I hope this is useful for other country comparisons also. Sorry. Computer is a bit slow. Okay, here we go. So thank you for this question. Very good question, because we really do need to delve into how countries are doing. So what you see is, I hope you're seeing it. Yeah, so this is the graph for each country and how they score for each particular article. So Brunei, mostly yellows. Cambodia, mix of yellow and red. Indonesia is the worst scoring, mostly red, some without even any score, and other countries as well. So the highest scores go to Singapore, mostly yellow, a few greens, and Thailand, a few greens, mostly yellow also, but then a couple of red. But the red is about 50%, so not so bad. But let's look at Indonesia. So why is Indonesia's score so low? First of all, I mentioned earlier that they don't have a focal point for tobacco control. They don't have a national tobacco control strategy. There's a lot of tobacco industry interference. They have not raised taxes, in the last year. Instead, they decided that they would maintain tax rates and fight illicit trade, because the tobacco industry is complaining about illicit trade. But that's not to say they're not doing so well. The Article 6 score is also low because they have a tiered tax system, and they have 12 tax tiers, or 10 or 12 tax tiers. Used to be 15, but now it's 10 or 12, so some improvement. And when they did actually simplify their tax tiers, they did see both a significant increase in revenues and a decline in smoking prevalence. But that hasn't been duplicated since that time, so it's been several years. They don't also do well with smoke-free, so not all public places are smoke-free by national law. They are doing subnational smoke-free. So there are some cities, local governments are doing their own smoke-free, and some are doing quite well. So, and that's why they do score here. Article 11, they have 40% graphic health warnings, but they have not rotated these warnings, despite their own regulation saying they should rotate every 2 to 3 years, I believe. But they haven't rotated, and it's overdue. They also need to increase, of course, the size of their health warning. And Article 12, this is where they're doing programs which are quite good but quite limited. Article 13, they're the only country that still allows outdoor billboards, for example. And they have TV commercials for cigarettes that come on almost every 30 minutes during the evenings. They're doing quite well in terms of cessation efforts. Okay? So they have guidelines and they have cessation clinics. But that's about it. And then they don't finance Article 26. They don't finance tobacco control, particularly as far as we know. So there's no data to support that. They probably say, oh, we have tobacco control program, and they have some money, but if you ask them how much, they can't really tell you. So I hope that gives you a reason why they score quite low. But I would also add that one of the reasons, and I explained this earlier, one of the reasons that all countries are not doing particularly well is that there is tobacco industry interference in all countries. It's a big challenge. I think the only country that says, oh, tobacco industry interference, we're handling it, probably Singapore. We know there is tobacco industry interference there, but because the level of corruption is quite low there, and there is greater vigilance with regard to tobacco industry interference, we know that the tobacco industry has not succeeded very well. So for example, with plain packaging in Singapore over the past few years, it was anticipated that the tobacco industry would challenge plain packaging. In fact, we have a study. We saw recently a study that was conducted under a research project, the School of Government, a regional study on illicit trade. And because tobacco companies said, oh, plain packaging will increase illicit trade, the researcher based in Singapore looked at all of the submissions to the government on plain packaging. And she discovered there were like maybe more than 70 submissions for opposing standardized packaging in Singapore. And these were from the tobacco companies themselves, from think tanks that are allied with the tobacco companies, even parliamentarians from other countries like the Philippines. We had legislators who are pro-industry write to the government in Singapore and say, oh, don't implement standardized packaging. But, you know, SIATCA also provided a supportive statement to the Singapore government, and there were others that were supportive. And the Singapore government looked at all of this interference and said, well, we have the evidence that backs us up. We know it's working in Australia. We know it's working in the UK. There are studies that show that. We know that we have done everything else in terms of tobacco control. So why should we not proceed with plain packaging? Even the trade challenge at the World Trade Organization to Australia's plain packaging was defeated. So there's nothing to stop Singapore. And Thailand had gone ahead of Singapore. You know, Singapore actually was contemplating plain packaging even before Thailand thought about doing it. But Singapore went far faster than them. So Singapore implemented in 2020, but Thailand in 2019. So that said, you know, I think Singapore looked at the industry interference and said, we're not going to listen to you. And they're doing quite well. Whereas countries that listen to the tobacco industry, like in Indonesia, or the Philippines, or Vietnam, we're lagging behind Singapore and Thailand. Thailand, I think, also has done well with regard to industry interference. They have a firewall between their state tobacco monopoly, TTM. It's now no longer TTM, right? It's but it used to be called the Thai tobacco monopoly. But there's a firewall, and so they're not influencing the policy directly. So I hope that answers the question and shows us the challenges ahead. So the scorecard tells us where we're succeeding, where we're not doing so well, and how we can improve. And it identifies for us also maybe some steps to take, you know, in trying to improve our scores, but also more importantly, to reduce tobacco use. Okay, Ian?
Thank you. Thank you very much, you. Okay, yeah. Thank you very much, you, for the detailed and comprehensive discussion on the instrument used in the FCTC scorecard developed based on the FCTC guidelines. As you have showed us, there are a whole range of questions with different scoring based on the importance of the question to each policy implementation. And each question is designed to objectively quantify the implementation of various provisions of the WHO FCTC at the national level. So I think we have a few minutes left before we end. If you have any questions, please type up your question in Q&A box. Maybe you would like to also mention when is the 2021 FCTC scorecard will be released and how do they get a copy?
Yeah, I did mention we usually launch our scorecards ahead of the Conference of Parties or during the Conference of Parties. We actually launched our 2016 scorecard during the COP in 2016 and in the 2018 one also during the COP. Since we have a virtual Conference of Parties this year, we'll do it ahead of the Conference of Parties, probably a couple of weeks before. So in the middle of October. if you're on our mailing list, you will be advised in advance. We will probably have a webinar on the scorecard. And yeah, you will find it on our website, siatka.org. If you want to, like I said, if you're interested in getting a copy, it will be downloadable from the website. And the questionnaire itself, we can also send to you if you send us an email.
Yeah, thank you, Yu. I think we come to the end of these sessions. Yeah, I would like to also echo Yul to encourage countries to assess their national implementation of FCTC, WHO FCTC implementation using this FCTC scorecard to identify both progress and also gap that need to be further strengthened. Yeah, and as you mentioned, Siaka will be very happy to share and collaborate with all of you for those who are interested to do the similar research in your countries. Yeah. Before I end, allow me to thank again our speaker, Dr. Ulysses, and also I would like to thank to all of you who have been with us this morning. Feel free to reach out to Dr. Yul if you have additional questions or interested to conduct a similar research. And with that, thank you very much.
Okay, great
Thank you.
presentation นะครับ Thank you for Dr. Yu and Dr. Yen นะครับ We have a 15-minute break and next section will go in 10:45. Thank you, and give a big hand for my speaker today. Thank you ครับ
Thank you.
Thank you.
ขอบคุณครับ
ขอบคุณครับ ขอบคุณครับ ขอบคุณครับ ดร. ยู ดร. เย็นครับ